I did my psychiatry residency training at Mount Sinai Hospital in New York City in the mid-1970s, and consistent with the training at that time, it was very much influenced by psychoanalysis. Our training director was Dr. Ed Joseph, who was a great psychoanalyst at that time, and I learned a great deal, which was very important to me. However, cultural issues really was not on the radar screen. Race, ethnicity, gender, sexual orientation. I did have one supervisor, Dr. Gerald Epstein, in my last year, who was very interested in religion and spirituality, which did influence my thinking in this area. And so after graduation, I was wondering what to do after graduation and decided to come back to San Francisco, which was the city of my birth. My parents had come from China in the late 1940s and met in San Francisco and married, and I was born there. But I really grew up on the East Coast, New Jersey and Maryland, and I thought it would be very interesting to return to California. Also, transpersonal psychology was really very much centered there, and so I thought it would be very interesting to come back there. So my first job was as an inpatient psychiatry attending physician at San Francisco General Hospital, working with chronically mentally ill patients, in 1977. In May of 1978, I first attended a seminar at Evelyn Institute in Big Sur, California, which is about 3.5 hours south of San Francisco on the Big Sur coast. It's a beautiful spot, and I attended a 5-day seminar on Hinduism and Buddhism in Oriental art, given by the great scholar of mythology, Joseph Campbell. And he was just great. He had all of these slides that he flashed on the screen, and he would give great stories about all of these myths. And at the end of that seminar, I was on the deck at Evelyn, and the sun was hitting the glass table in a certain way. And I had a very profound experience, an epiphany, that my purpose in life was in some way to bring together the East and the West. And I didn't know really what that meant at that time, but it was a very profound, very deep feeling that I had. And looking back now, over 30 years now, I really can see how that has come about in very real ways. Well, one way that I've brought together the East and the West was in 1980 when I started the Asian Focus Inpatient program at San Francisco General Hospital, and also part of the Department of Psychiatry at the University of California, San Francisco, where medical students and residents would rotate through. This was the very first Asian Focus Inpatient program in the country, and it provided an Asian focus to inpatient services that corresponded with pre-existing Asian-focused outpatient services that existed at that time. About 22% of the city was Asian at that time, and many patients had limited English proficiency. It was really important to have staff that could speak with the patients as well as understand their cultural needs. And we had support from the city and the hospital and the university to start this program. So we had this program from 1980 until 2010. And at one point we had staff that could speak 16 Asian languages and dialects of Chinese on the unit. So, for example, Cantonese was the most predominant Chinese dialect in the city, and so we had a Cantonese-speaking psychologist, nurses, occupational therapist, even the unit clerk and the social worker all spoke Cantonese so they could relate to the patients and the families. The Asian Focus Unit provided a wonderful and unique training experience for the medical students and residents And it began to serve as a way of making our training program unique and help to recruit culturally diverse residents to our program. Not only Asian, but Caucasian residents. So two Caucasian residents that I worked with in the late 80s, early 90s, Ladson Hinton and Douglas Zatzig, were very influenced by their experiences as first-year residents on our Asian Focus unit, and I think affected their careers in terms of incorporating cultural issues in their work, so that now in 2014, Ladson Hinton is a professor of psychiatry, director of geriatric psychiatry at UC Davis, and does work on ethnic minority elderly. And Douglas Zatzig, I believe, is associate professor, or maybe at this point professor of psychiatry at the University of Washington, and also has incorporated cultural issues in his work. So from the Asian Focus unit as a model, we actually developed additional focus programs. So on another inpatient unit, we developed a Latino and women's focus programs. On another unit, we had an HIV and gay lesbian focus unit. And on a fourth unit, we developed a black focus program. And so these four inpatient units developed these specialized programs, which again help to attract residents interested in cultural issues and provided a very unique training. And our programs were recognized with awards. So in 1987, the American Psychiatric Association awarded us a Certificate of Significant Achievement for these programs. And in 1999, the American College of Psychiatrists awarded us with a Creativity in Psychiatric Education Award. In 1994, the American Psychiatric Association published the Diagnostic and Statistical Manual 4th edition, and buried in Appendix I is the outline for cultural formulation. Russell Lim, myself, and Juan Mezich wrote a chapter for the Annual Review of Psychiatry, which was published in 1995, about the outline for cultural formulation, and I think it was one of the first articles or chapters on the outline. And since that time, Russell Lim and myself, and also Dr. Mezich, have just been speaking and writing about the outline for cultural formulation as a clinical tool to help clinicians bring cultural issues that they see in the patient encounter into clinical care, into assessment, differential diagnosis, and treatment planning. And so some examples of that are that in 2002, a DVD came out entitled The Culture of Emotions, which was a 1-hour DVD about the outline for cultural formulation, where 26 multicultural experts, mostly psychiatrists, commented on each of the 5 sections of the outline. And those 5 sections are the cultural identity, the cultural explanations of illness, the cultural stressors and supports, the cultural features of the relationship between the clinician and the patient, and finally the overall assessment for diagnosis and care. And then in 2007, I was involved with the production of another DVD entitled Saving Face, Recognizing and Managing the Stigma of Mental Illness in Asian Americans, where we had simulated interviews between 3 Asian American psychiatrists, all of whom had been mentored by me at UCSF as they were going through their residency program, interviewing simulated patients and showing where the stigma of mental illness came up and how the psychiatrists dealt with it. And we produced a resource guide using the outline for cultural formulation to discuss the cases. Well, My career was very much influenced by my networking and connecting with other psychiatrists interested in culture, religion, and spirituality. And there were many organizations where I had that wonderful opportunity to connect, and I just wanted to mention a few of these. First and foremost, of course, is the American Psychiatric Association, and now in 2014 I hold the title of Distinguished Life Fellow of the APA, and actually since 1984, that's all 30 years now, I've attended every annual meeting and I have presented at every annual meeting. I'm not sure exactly what that means, but it's an interesting fact, and I have had the opportunity to present on so many topics over the years, but culture and psychiatry, including religion and spirituality, and film and video have been very much part of many of my presentations. Another organization that I've been involved with for over 20 years has been the Association for Academic Psychiatry, which is a wonderful meeting for psychiatrists to learn about teaching and mentoring, a very warm and supportive group of people. And there I worked with Shimon Walfogel on religion and spirituality initially. And later on I was involved with the National Institute for Healthcare Research that was directed by David Larson. But in 1996 I recall working with him and James Swire and other colleagues to create a curriculum on religion and spirituality for psychiatry residency training programs. And I've continued my work in this area with John Petit, who has been very active in leading the Committee on Religion, Spirituality, and Psychiatry. We co-edited a book along with William Narrow on religious and spiritual issues for DSM-5 that came out in 2010, published by the American Psychiatric Press. Another organization that I've been very involved with for since the early 1990s was the American Association of Directors of Psychiatry Residency Training Programs. And there I really began to learn about the accreditation standards for training programs and had the opportunity to impact on the 1995 revision, the 2001 revision, and finally the 2007 revision. So that in each of those revisions there was an inclusion to greater degrees of cultural issues in the requirements. So for example, before 1995, concepts of race, ethnicity, gender, sexual orientation, and socioeconomic status were not explicitly listed amongst the topics to be taught in residency training programs. And through the help of colleagues at the American Psychiatric Association, such as Carolyn Rabinowitz, we were able to suggest and to advocate for the inclusion of those topics explicitly. And I think that that's provided a very important basis for the development of curriculum in this area. In 2010, the ADPERT initiated a model curricular award, and they selected cultural psychiatry as one of the two topics to start off with. And UC Davis and NYU were the two awardees, and I'm very happy to say that Russell Lim, one of my mentees at UCSF when he was a resident there in the early to mid-90s, headed up the UC Davis curriculum. and also that Helena Hansen, who is someone that I've also gotten to know, headed up the NYU program as well. One more organization that I would like to just mention briefly is the Society for the Study of Psychiatry and Culture. I first attended the annual meeting in 1990 at Mount Hood, and the president at that time was Ron Wintrobe from Brown University, who was a very caring and supportive man, and very kind man. And he had encouraged my involvement with SSPC, and so in 1994 I was the program chair for the annual meeting that was at Asilomar in Monterey, California. And I've continued my involvement. I currently, here in 2014, serve as the secretary of SSPC. And this is another place where people interested in cultural psychiatry come and network and present, and it's been a very important part of my career development. Reflecting back on my work with the American Psychiatric Association, I just wanted to share some very moving moments for me, and I think for the organization and the field of psychiatry. In 1989, the APA annual meeting was in San Francisco, and I was on the committee of Asian American psychiatrists at that time. Joyce Kobayashi from Denver was chairing it, and we planned an international symposium on psychiatric research in Asia, a one-day symposium. I remember helping to plan that meeting and gathering psychiatrists from the Pacific Rim to talk, because it was a conjoint meeting with the Pacific Rim College of Psychiatrists, and even helping to plan the wonderful dinner for the delegates at the North China restaurant on Van Ness Avenue. I also remember actually at another annual meeting in San Francisco, one in 1980, meeting for the first time Evelyn Lee, who was a very dynamic Chinese woman born in Macau and had migrated to the United States. So was a social worker, and later on earned her doctorate in education. Well, she was very much a pioneer and an advocate for Asian mental health. And I said to myself, we had to recruit her here to San Francisco General Hospital, and I'm very lucky to have her join us in 1982, and she very much affected the development of our Asian-focused inpatient program and the other ethnic minority inpatient programs that we had. And two other moments that I'd like to share. One is in 2001 at the September components meeting of the APA, when we would gather together and talk about APA business. I had the opportunity to have a sidebar conversation with President Richard Harding about the Surgeon General's report, Mental Health, Culture, Race, and Ethnicity, that was going to be presented in a few days by David Satcher, who appeared just before 9/11 actually, and he gave his talk, and right after that Dr. Harding got up and said that the APA would implement a plan to reduce disparities in mental health. It was a very dramatic moment, and I later served on a task force that helped create an action plan for that, and Dr. Pedro Ruiz, who later became the APA president, worked with Anel Prim, the deputy medical director of APA, to co-edit a book that was published in 2009 entitled Disparities in Psychiatric Care, which discussed disparities not only by race and ethnicity, which was the primary focus of the Surgeon General's report, but also disparities related to other cultural identity variables as well as clinical conditions and settings. Finally, in 2005, the committee of gay, lesbian, and bisexual psychiatrists worked on a position statement concerning the support for the legal recognition of same-sex civil marriage. And I remember very vividly going to the assembly in Atlanta in 2005 to help advocate for that position statement. And with so many of my colleagues, such as Jack Drescher and others, we were successful in having that position statement pass through the assembly. And I remember that Saturday night there was a reception of the Association of Gay and Lesbian Psychiatrists, and it was such a happy time for us to be there for this momentous event. Mentorship has been very important for my personal and career development. In college, Professor Bert Leifmans, a professor of French, was a mentor about the importance of humanities and the classics in understanding human issues. In medical school, Professor Bernie Bergen, who was a sociologist, and I would meet to talk about existentialism, and it was a very rich and deep experience for me. And during my first 10 years at San Francisco General Hospital and UCSF, Dr. John Hopkins provided very important mentorship for me in development of my career. And so, knowing how important it was for me, I began to naturally mentor medical students and residents and junior faculty, and did so throughout my 32 years at UCSF, and also my 4 years at UC Davis as the Luke and Grace Kim Endowed Professor in Cultural Psychiatry, which was the first professorship in cultural psychiatry in the United States. Luke Kim was a clinical faculty member at UC Davis for 30 years. He originally came from Korea and lived through the Korean War and taught cultural psychiatry at UC Davis, and he wanted very much to leave a legacy, and so created this endowed chair along with his wife, Grace. And I was very fortunate to have the opportunity to be found in national search, and I later learned that, in fact, I was the person that he hoped would take this position. So I felt very fortunate and lucky to have this opportunity. And as it turns out, 3 residents that I mentored at UCSF had all found their way to UC Davis and were faculty members at the time of my interviews, and in fact they were involved in recruiting me to UC Davis. So I find that just very interesting. Those 3 being Russell Lim, who has been my partner in spreading the good news about the DSM-4 and now DSM-5 outline for cultural formulation. He started the Diversity Advisory Committee with the support of his chair, Robert Hales, in 1999. And that Diversity Advisory Committee won the American College of Psychiatrists Creativity and Psychiatric Education Award in 2007, and continues to be a way of making sure that diversity is included in the Department of Psychiatry at UC Davis. Secondly, Henry Tan was a resident at UCSF in the late 90s, and so after he graduated about 2001, got a job at UC Davis and is currently Associate clinical professor of psychiatry and director of medical student education at UC Davis in psychiatry. And I should mention, of course, that Russell is now a clinical professor of psychiatry. And thirdly was Ladson Hinton, who was a Caucasian resident who worked with me in the late 80s. And I should say a little interesting story about Ladson is that in his first year when he was on the Asian Focus Unit, we had a patient who needed to be escorted back to Beijing. So he was lucky enough to be given that task of bringing back a psychiatric patient to Beijing, and the Chinese government, of course, treated him to tours and so forth, and I think that that may have been one of the factors for his interest in cultural psychiatry. So he was very successful going through the Robert Wood Johnson Clinical Scholars Program, and eventually becoming and also working with Dr. Arthur Kleinman at Harvard, and is now a professor of psychiatry at UC Davis, director of our geriatric psychiatry program, and working with ethnic minority elderly. So all three of those residents that I mentored actually were recruiting me to UC Davis. So I think that that's just a perfect example, I guess, of how mentorship works and how both the mentees and the mentors gain a tremendous amount through the experience of mentoring.